Next question. Is there a genetic cause for dissection? What is the screening process, and what does that look like for siblings, children, grandchildren?
I was just going to say that I think Dr. Nguyen has eloquently answered the question regarding the genetic, causes for aortic dissection and stuff. So basically, there are conditions like Marfan syndrome, Ehlers-Danlos. Bicuspid aortic valve actually have aortopathies that can predispose for aortic aneurysms and dissections. And those conditions, when you have family members that have them, if, for example, somebody with a bicuspid aortic valve in your family, you should have your first-degree relatives checked and your offsprings checked, particularly if there's more than one in the family tree. And the way these are surveyed, as was implied by Dr. Nguyen, is to have regular echocardiograms, check with your primary care provider, and get established with a cardiologist so these can be monitored. And because at certain sizes, at certain diameters, there is a higher risk of rupture than the risk of surgery. So at that point of crossover is when you tend to manage these patients. And if your size of your aorta is not at that range yet, then you are carefully monitored. But basically, you want to be established and to be monitored regularly.
Thank you. I would only add to that that in addition to the genetic abnormalities, as Dr. Go mentioned, even more common probably is that a congenital abnormality of the aortic valve, which I assume you had, typically it's called bicuspid. So the normal aortic valve has 3 cusps. For those of you who remember, it looks like a certain beer sign from many years ago. There aren't too many people who remember in any event. And then a bicuspid valve has only 2 cusps, bi meaning 2. There is a very high frequency of the aorta becoming enlarged in the bicuspid valve. The proof of it, I mentioned earlier I was in my adult congenital heart disease clinic. We saw 5 patients with a bicuspid aortic valve and an enlarged aorta. And we have very good data to know when we need to suggest prophylactic, ahead of time, aortic ascending aorta replacement with or without a valve, depending upon the valve problem, to prevent aortic dissection. So this is where screening is very important. By the way, how do you diagnose a bicuspid aortic valve? This is something I tell my medical students a lot. Yes, we do echocardiograms and other things like that, but the first line is someone who is skilled in listening with a stethoscope, because there are typical findings in a bicuspid aortic valve in a young person that someone who is skilled in doing it can identify at the bedside. So this is, again, an example of we don't want to wait until a problem occurs. We want to try to identify it ahead of time. But I agree with what was said. Most bicuspid valves should be identified in childhood. And I can't tell you the number of adults I've seen when I tell them that they have a bicuspid valve, they say, I have a what? And it should have been diagnosed before. So we who do education need to do a better job in making people aware of the things you listen for. But there are pretty typical findings for many patients with a bicuspid valve that we can identify ahead of time so that we can intervene as necessary to prevent dire outcomes.
Thank you for being a part of the Rock from the Heart community and for joining us today. Your presence and engagement make a huge difference in raising awareness and building a stronger support network for those affected by aortic and heart valve disease. Thank you so much for attending today.